Good morning and welcome. This edition of what's happening in the clinic and what's happening in the world largely have revolved around mental health issues since the onset of the pandemic, but I think it's been an example of heightened anxiety and emotional disruption that have affected so many people, so many folks in my practice, my own family, and I'm sure yours as well. And I wanted to take some time to review some of the techniques and potential treatments that may be beneficial to incorporate along with other lifestyle approaches to help with centering, calming, to try to get through this very difficult and challenging year of 2020. What I have been reminded by many of my patients when discussing things in retrospect, really since the onset of COVID-19, has been an explosion of folks dealing with various symptoms ranging from increased irritability, just being around other people, being forced to stay in their own home, not being able to get out as much with their family and their friends, their circle of friends. All very expected, but it's having, I think, over time, a detrimental effect on sleep. It may be affecting their vitality, reporting tiredness, affecting mood, heightened anxiety. Don't feel like I can get comfortable with my own thoughts. And there's a spectrum. I mean, it can be very minor for some, have not had it happen to where they've been affected much at all, and others seem very much so affected. In perspective, mental health or the psyche has been a focus not only with traditional Western approaches to helping the mind, but also old some say back as far as 6,000 years ago, mental health disturbances that the Chinese had talked about in traditional Chinese medicine way back, describing what was referred to as the mental body or the spirit, different from the Western interpretation, but nonetheless, this dovetails nicely with a conversation that we often include as part of our course curriculum when I get to teach for the Helms Medical Institute or the ACUS Foundation, teaching both civilian and military physicians and care providers how to approach more issues that would verge on mental health disturbance rather than a physical pain, somatic problem like back pain or knee pain, headache, etc. We often find an overlap in mind-body medicine. We all know that one tends to drive the other. So not uncommon if anybody's experienced or had exposure to folks with a profound increase in stress or anxiety, and all of a sudden, hey doc, my back pain is a lot worse, but they don't necessarily connect the dots. We in our military and civilian training incorporate a lot of mental health approaches to calming and centering, largely because we find that not only active duty military deal with this, but so do many civilians, and it's obviously becoming a lot more apparent in areas in my own world in medicine, just since this pandemic has affected our country. Many of our colleagues dealing with frontline healthcare putting essentially themselves back, and we're going back to February, March, where big centers were being hit with high numbers with COVID-19 patients in hospitals. Example would be many people going into harm's way, some without adequate protection, some going into it with the feeling that they were not being supported by those who they were representing, and having challenges still with after effects that would very much be similar to the type of descriptions that a soldier might report after being in battle. This can be very minimal to almost threatening somebody's ability to function. So again, the spectrum can be from minor irritability, depression, sleeplessness, changes in appetite, lack of interest in doing usual activities, all the way to what would formally be under a diagnostic consideration for post-traumatic stress, which we see in first responders, we see in folks who've seen literally battle, but also in the trenches in places like healthcare, first responders like firefighters, police, EMTs, medics who are called to a scene, and even a citizen who's experienced something traumatic. Might have been at a function where somebody got into a fight. It could be witnessing a car accident. It could be somebody near and dear that they saw injured or somehow traumatized, that they continue to have these memories, intrusive memories particularly, flashbacks, nightmares, heightened, referred to as hypervigilance, always being on the ready. These are some of the symptoms of post-traumatic stress that I think we've over the years have become a lot more aware of, is not just showing up at military arenas. So we've learned a lot over the last decade and have applied a lot of these techniques in both our military and civilian training to make sure that providers are aware of how in an acupuncture realm we may be able to address these symptoms, along with cognitive behavioral therapy, neurofeedback, biofeedback, meditation, adequate diet, appropriate diet, getting enough sleep. So it definitely is a role player with other approaches that we find that with a comprehensive package can definitely help with keeping people on the more of a balanced day-to-day rather than feeling off, feeling imbalanced. So I will put a plug in for a program that I will include a link with this discussion below, that was actually formulated by a collection of faculty that I am honored to teach with, and they put together an online program specifically geared toward health care providers. So if you are a healthcare provider, or if you know a healthcare provider that may be interested in a way to learn a fairly simple, elegant technique that's gone through years of refinement, I'll include a link that incorporates a video series also here on YouTube, going over steps that basically help to calm and center the patient. And it was the name of it is COVID-19 Rapid De-Stress Protocol. So this protocol was derived from the training that we give to our military. So certainly a shortened but a very effective treatment of getting people more balanced and centered. So again, I mentioned symptoms in more severe cases of post-traumatic stress, incorporating described symptoms of flashbacks, reliving the same trauma that got them into this situation in the first place. Hypervigilance, they may be having nightmares about these events that just keep, it's almost like a video loop that just keeps playing back again and again and again. Hypervigilance may be walking into an area that might remind them of a zone of danger, and they just can't settle down. They may experience heart palpitations, almost feeling panic disorder, may get triggered, emotional lability. They're tearful one moment, anxious the next minute, uncontrollable thoughts about what happened to them in the past, a sense of agitation, irritable, and fatigue. Many cases of adult mental health issues may not come in feeling, hey, I feel sad, but I'm just wiped out, I feel tired. With just this past week or two on the West Coast, we have been experiencing significant forest fire smoke from a whole entire West Coast band of forest fires. That's added to the hypervigilance anxiety, the sense that the brain is being triggered by sensing and smelling and seeing forest fire smoke kicks in and from an evolutionary standpoint says, hey, be careful, there's something going on. And that's probably true for most mammalian brains, is to take cover and be cautious. So that has added to the whole pandemic of COVID-19. Now we've got forest fire smoke in my backyard, that people are just becoming much more symptomatic. I wanted to mention how and where does this information in the brain even register, and then it might make more sense when we talk about where and how some of these points on the body are treated with acupuncture as one mechanism. Could be with acupressure, but our school teaches acupuncture using needles. So I wanted to show you a diagram of a model of the brain where this schematic is showing what we refer to as the limbic system in color. And the limbic system is the old, if you will, the reptilian brain that is engineered for survival. It is engineered to not necessarily be too logical. It basically is getting into the emotional tracks. It incorporates parts of the brain called the thalamus, the hypothalamus, the hippocampus, and very important with memory and logging old memories, and the amygdala. The amygdala has qualities that would be both positive and negative in the fact that the amygdala may register memories that may be very oriented toward happiness and joy, but this may also be the area triggered with anger, being profoundly irritable and verging on anger. And to note that these centers in the brain are tightly tied in with what we'll talk about in a minute, is referred to as the area of the brain called the prefrontal cortex, in the anterior portion of the brain. And that part of the brain has higher executive function that interprets information. So this schematic isn't isolated. This part of the brain, the limbic system in general, is tightly keyed into higher thought, higher executive function, which starts to be affected when people are under duress with strong emotional triggers for too long. In the training that, if some of you who are interested in pursuing the COVID-19 Rapid De-Stress Protocol, incorporates auricular or ear acupuncture points to address these locations in the brain, as well as several body points that help to calm and center the body. Some of this information, interestingly, goes back many, some would say centuries, to old treatments that the traditional Chinese masters would incorporate. One of them referred to as four gates, where points on the hand and feet on both sides are treated with acupuncture needles. One of our esteemed colleagues, Dr. Bob Kaufman, retired psychiatrist, found that when he was in forward areas overseas, he was a psychiatrist in the U.S. Air Force, treated those folks coming back from front lines using what essentially would be four gates, along with an additional pair of points on the head. One on the very top crown called Baihu, or governor vessel 20, and one, some who are in yoga may note this as one of the referred to as the third eye, or in our world referred to as yin tongue, or governor vessel 24.5. When these points all together are placed, it can provide a very calming sense of equilibration, centering, better focus, and typically we use the points on the ear in combination with the body points in a combination that can be a very safe introduction for patients who've never experienced acupuncture. And it's a fairly easy thing to learn, and hence, again, this program that providers have put together a several video series, plus if interested, in an additional packet of information that you can obtain for those interested in adding this to your armamentarium of treating patients. I use this, I would say almost every day. And for the past several months, a grand percentage of my patients have been very well receiving. Comments that patients will say after treatments is, I can think straight again. I can feel like I can actually get through my day without spinning into a world of anxiousness that is propelled by things around us every day of the week. So it can be a very helpful tool for those that are coming in with strong psycho-emotional disruptors. It can be for those who've seen literally and figuratively battle of some form. But the good news is this is an easy technique to learn, and one that hopefully, if you are either in healthcare or know people in healthcare that may be interested, please do feel free to share this video. Time is of the essence because we have a number of healthcare practitioners I know of secondhand and firsthand who've decided to step out of the practice. They may not be in medicine, they may be in body work, they may be in psychology, they may be in areas that we need these practitioners to still be helping patients, but times have been very overwhelming and some have elected to take time out. This may be a tool to get them back in the game if possible. So I wanted to put together this to summarize what auricular or ear acupuncture can offer for stress, for formal PTS, even depression, help with insomnia, and help to get folks feeling back on track again. Because again, in the old Chinese teachings, if the mind or the psycho-emotional body, referred to as the Jing Shen Shen, if the mind was not balanced, physical symptoms would not respond. So you had to take care of the mental aspects of what was happening before physical symptoms would resolve, and we see this quite frequently. So it's extremely important in mind-body medicine to address. I thank you for your attention. If you have any questions, feel free to reach out and touch base with me. You can reach me at my office directly or email. And again, I will include information to contact a group of providers who put together this package of information if you want to pursue. I wish you all the well and hope your mindset is a little calmer after this, and do take care of yourself and yours. Appreciate your time. You have a good day. Take care. Bye.